Hello and welcome to the Physio channel. In this video we're going to have a look at 7 ways in which you can reduce the pain from a Mortons neuroma. That is irritation of a nerve between your metatarsals in your foot, usually between the 3rd and the 4th metatarsal, with the pain being quite specific between those bones and felt on the sole of your foot, but also potentially palpatable over the top of your foot as well. Let's have a closer look at where the pain is usually located. So the pain from a Mortons neuroma usually occurs between the 4th and the 3rd metatarsals, so in that web space there just between the toes, and it's typical to have some palpable pain around here if you press. Also underneath there can be some palpable pain in that same space when accessed from the sole of the foot, and it may feel like you've got a small pebble or something stuck in your shoe, or you're walking on a small stone, because the swelling of the nerve is causing that discomfort underneath your foot as well. So there's pain there, pain over the top, and the pain is quite specific. Now, because the pain is caused by irritation of the nerve between the metatarsals there are a couple of tests which you can do, what we call clinical tests or special tests, which a physiotherapist or podiatrist or chiropractor, for example, might do in order to determine whether it is a Mortons neuroma. And you can have a go at doing these tests yourself, but they're generally not that nice to do. So I'll put a link in the description to these specific test videos, but I'll just show you a home version of how to do them here. So the first one is the metatarsal squeeze test, which, as the name suggests, you want to grab the metatarsals of these foot bones. You want to grab around your foot and squeeze your foot and see if that exacerbates the pain. You can also, if your hands are big enough, is squash your foot so that it makes this concave position. That is, the bottom of the foot is being squashed and the big toe is being pushed towards the little toe there. So you can squash the foot like that and then take your finger and prod that area to see if that causes the pain. As I said, not really a very nice test, and you might not need to do this, but it's the sort of test that a specialist might do in order to determine whether it is a Mortons neuroma. The other one is called the Mulder's test, and for that one you need to grab the outside and the inside of your foot, push the metatarsals together, push your foot bones together, and then move one side up and one side down so that you're rubbing the metatarsals together. And then if there is an irritated nerve in between, it's going to be squashing and rubbing that nerve, and it's going to hurt. So a positive test for either of those tests is pain when you do the test in the location of the Mortons neuroma. If you're interested in the anatomy of a Mortons neuroma, I'll quickly explain it to you. So you've probably heard of the sciatic nerve, the big large nerve that travels down the back of the leg. Well, as the sciatic nerve passes the knee, it then starts to split into smaller branches. One of those is called the tibial nerve, and the tibial nerve itself, rather like a tree, splits into smaller branches as well. And a couple of nerves come down underneath the foot, and they span out to the inside and the outside of the foot. And as they get towards the toes, the nerves split again and get smaller, and then we have these small digital nerves which come down each side of the metatarsals and into the toes. So it's thought that one of these digital nerves, that is the one that sits between the 3rd and the 4th metatarsal, has or is affected by the transverse ligament. Of course, there's the ligament across all of the metatarsals, but there's one here that's over the top of the nerve, and for some reason it seems that the nerve gets squashed underneath that ligament, and that ligament pushes down, and obviously the floor's pushing up. It doesn't have enough space, and the nerve gets irritated, and when a nerve gets irritated, it starts to swell, and if it's swollen for a period of time, it starts to get thicker and what we call fibrotic. And we've got this then thickened nerve, which is more easily irritated because it's thickened. It's a bit swollen, it's extra sensitive, there's more fluid in the area, and then that gives us our Mortons neuroma. So what we need to do in this video is find out how we can reduce the pain, and possibly how we can even cure a Mortons neuroma by thinking about the foot and thinking about the causes and seeing if we can change the space and the pressure that's acting upon the foot. So let's have a look at what we can do. So the first thing we can do is think about footwear and making sure that the front of our foot has enough space in the shoe. We call this part of the shoe the toe box, and you want to make sure that your shoes have a nice wide toe box so that your feet can spread out. Now, if you've got generally narrower feet, then you won't need such a wide toe box. But if you have got wide feet, when you look at your feet barefoot and you don't have any shoes or socks on, then you will need to make sure you have an extra wide toe box. Now, you can usually find shoes with a nice wide toe box by going to a shoe store or trainer store. You'll usually be able to literally visually see a pair that has a nice wide toe box and try them on and make sure they are comfortable. Now, it stands to reason that the simplest thing to do would be to pop your foot in and make sure that your toes have enough space, but you can also just take the shoe and match your foot to the shoe and have a look and see how well your foot fits in the shoe before you actually put the shoe on. So looking at the bottom of the shoe and looking to see how wide that nice toe box is. And if you wear more formal shoes, then once again you'll need to have a look. So if you take one like this, for example, I'd say that toe box is pretty narrow and could be problematic if you have any toe pain, whereas this one here is a little bit wider and therefore might be more comfortable. So shoe choice, a wide toe box is probably going to help significantly, because remember when we did those special tests, they were about squeezing the foot bones, those metatarsals together. With the metatarsal squeeze test and the Mulder's sign, they were both about squeezing together. So therefore, if your shoe is squeezing your foot together, then that could be the cause or certainly an aggravating factor. So a wide toe box will offer you some relief. Here's the second strategy. For this one, I need some socks. Let me show you why. I've had a few patients that have probably caused their Mortons neuroma by wearing too many socks or socks that don't fit. So here's my advice. Firstly, make sure your socks are not too small. If you wear socks which are too tight, it stands to reason that it's going to squeeze your metatarsals together and possibly cause, or if you've already got irritation of a Mortons neuroma, then that could be exacerbating it because your foot can't spread out. So don't wear socks that are too small or too tight, for example. And also, I've had a few patients who've caused the issue due to their socks. And what it was, I can remember one particular patient, they were living in a cold part of England in the winter and their feet were getting very cold, so they were putting on lots of pairs of socks, which worked in that it kept their feet warm. So they would put on sometimes 3 or 4, maybe they even told me 5 or 6, I can't remember, but they were putting on lots and lots of pairs of socks, so they had lovely warm toasty feet. But you can see where this is going, folks. With too many socks, then I start to get my, there we go, we've got 4 of socks on there. There we are, and then I'm going to go and get my shoe and squeeze my foot into the shoe as well. And come on, there we go. Lovely and warm and toasty, except I can feel now that my foot is rather squeezed, and therefore when I put weight through it and the front of my foot wants to spread out as is natural, the toes and metatarsals want to spread out when I put weight, that's not going to happen because my shoe has effectively become tighter because I've got 5 pairs of socks on. My feet are going to be nice and warm, but I'm probably going to start to irritate my nerves between my toes and give myself or irritate a Mortons neuroma. Don't wear socks that don't fit, and don't wear too many pairs of socks, because I've had patients that have done exactly that, wore too many socks, and that was the cause of their Mortons neuroma. The next piece of advice is to avoid resting in this squat position. That is when you're right down with your ankles maximally dorsiflexed and the weight over the front of your foot, so that the weight's going through the metatarsal heads there, that area where the Mortons neuroma occurs. Now, you may be habitually or regularly dropping into this position at work, especially if you work in low down positions, like working with young children or with animals, or working as an engineer or electrician, for example. Dropping down into this position is putting a lot of weight through the front of your foot, and if you're preoccupied with a task, you may not have realized that you're spending a considerable amount of time like this. If you think about it, it's similar to wearing a heeled shoe, because your heel is up and there's a lot of weight going through the front of your foot. So have a think about your work postures or postures you're regularly dropping down into, and try and avoid going down into this position. A simple solution, of course, would be to have something to kneel on or to sit back. Really anything which changes your position. So just coming down onto a cushion, again, making sure your toes aren't flexed back, dropping down there. If that's uncomfortable, you can also put a cushion behind here. Simply having a few cushions with you that you can kneel on or rest on can be a very simple way of reducing the time you spend or stopping yourself going into that position, which may be an aggravating factor for your Mortons neuroma. For this next strategy, we're going to have a look at a metatarsal dome. That is a piece of material that helps the metatarsals to have a dome shape, and I'll explain that a little bit more in a second. So here we have an insole where it actually has a metatarsal dome as part of it, and you can see that that's just slightly raised up from the insole, so it helps to create an arch or a dome shape in the foot. And that's important because our foot has 3 arches. Most people know the foot has an arch, but it actually has 3, not 1 arch. So let me show you my foot and show you where the arches are on the feet and which one is important when it comes to dealing with Mortons neuroma. So here's a close-up of my foot. Let me explain the 3 arches of the foot. Most of us know this as the arch of the foot. That is the medial longitudinal arch. There's also a lateral longitudinal arch, which runs along here. And the arch we're most interested in when it comes to dealing with a Mortons neuroma is the one which goes across the front of the foot, and that's the transverse arch. Now, if we use a metatarsal dome, which is simply a piece of material which has been shaped and crafted to be comfortable, so I've got a packet of metatarsal domes here, and I'll put links in the description to the products that I'm using. You could also fashion your own metatarsal dome. Here I've used some orthopedic felt to make a padding which could go under the foot or in the shoe like so. But let's have a look at these. So I've got my right foot here, and this one says right on it, so that's the correct one. So for these metatarsal domes to work, they need to be in the correct position. Typically they need to move back a bit away from the metatarsal heads, and then you might find them helpful at reducing pain from a Mortons neuroma. But if they're in slightly the wrong position, they may actually make it worse. And for some people, they just don't get along with them and they don't find them helpful. But they are usually cheap to buy, depending on where you're getting them from, and therefore it is worth trying them to see if it offers some relief, because as I say, for some people it can offer quite a lot of relief. So what I recommend is either undo all of your laces so you can get easier access to the shoe, or simply remove the shoe liner, place it on the shoe liner, and then you can work out the best position to put the metatarsal dome. Once you have determined the best position, then simply peel away the backing paper. Try not to touch the glue side any more than you have to, and place it on the liner in the desired position. Pop the liner back in your shoe, foot in the shoe, and hopefully that should give you some relief. And it does that by helping to support the transverse arch of the foot, which creates a bit more space between the metatarsal heads and take some of the pressure off that Mortons neuroma. So I'm going to leave that in my shoe and see how I get on wearing that today. So to recap, that strategy was about using a metatarsal dome, which is simply a piece of material correctly placed under the transverse arch of the foot, that is under the foot bones, under the metatarsals. And then when you support the transverse arch of the foot, it creates a slight dome shape, which is albeit a natural position for those foot bones. And when they're in a dome shape, there's more space between the metatarsal heads to take some pressure off that Mortons neuroma. And you can get the metatarsal domes already fitted in insoles or in foot liners like so, which although looks very convenient, sometimes is a bit difficult because you can't actually move these around in order to get them into the correct position. So the position is set, therefore they're less likely to be helpful and not possible to customize them. You can also make your own, which might seem a bit of a faff, especially when they're quite cheap, but if you're not sure whether they will help or not, you might want to fashion your own from an old pair of shoe inserts or a piece of orthopedic felt, for example, and then you can test the concept, and if you feel it helps or might help, then you may want to go and buy some off the internet or from your pharmacist. Metatarsal domes usually come in packs of 2 or 4. They're inexpensive and easy to pop in your shoes and try. But remember, they need to go into the correct position. So read the instructions on the packet, but as I showed you, if you take the liner out of your shoe and then put your foot on and make sure that the metatarsal dome is in the correct position. Once it is, you can stick it down, pop the liner back in your shoe again, and that should hopefully provide some pain relief via that mechanism that we've been discussing. So they're the metatarsal domes. Hopefully they will help. If they don't give up, try and change the position of them. And then if they don't work, well, that's a shame, move on and try something else. But at least you've tried, because for some people, the metatarsal dome can be really helpful. So if it helps you, please let us know, pop a comment below. And if you've got any further tips that you've discovered from using these things to try and help alleviate pain from a Mortons neuroma, please pop it in the comments below so that other people can have a read and learn from it as well. Let's have a look at what we've got coming up next. For the next bit of advice, we're back to footwear again. But before we get on to that, if you're finding this video helpful, then please like and subscribe, and consider leaving us a comment at the end to let us know which of these techniques and strategies you found the most helpful for reducing your Mortons neuroma pain. So as I said, we're back to footwear again, and I want to talk about heels and heels on shoes. So if you're wearing a shoe with a heel, as you can see, it's going to tilt the foot forwards and therefore put more weight through the front of the foot. And this links into what I was just talking about that squat position where you're loading up the front of the foot, which inevitably could be putting more pressure over that painful area. So it's not just about the front of the foot. Remember, we talked about the toe box. It's about the heel on the shoe as well. So if you're wearing what I might class as a kind of standard traditional heeled shoe, wearing a flatter shoe could make all the difference, because the heel, as I say, pushes the weight over the front of the foot. And even if it's only doing that a little bit, if you think about how much time you spend on your feet and think about how many steps you take per day, that little bit, literally a few degrees of angulation, could make all the difference to your symptoms and the build-up of pain and discomfort that you might experience towards the end of the day. So experiment with different footwear, a wide toe box, and this tip was to reduce or even wear a flat shoe so you don't have the heel tilting the foot and putting pressure over the front of the foot. So this next strategy is a taping technique that I've been trying with my clients and getting some good results, and I've had good reports from my colleagues as well. So to do this, I'm going to use some RockTape, and any of you who've watched many of my other videos know that I'm a keen advocate, user and an educator for RockTape. So I've got ourselves some RockTape here, and I'm going to take the tape. I've got the 5 centimeter tape. I'm going to take some tape. I'm going to cut a piece of tape off. So what I've done is cut a strip of tape away from the 5 centimeter width tape, and I'd say that's about 2 centimeters wide, but you can decide whether you want it to be a bit wider or a bit narrower. Let's have a look at what we're going to do for this technique. So to perform this special taping technique for Mortons neuroma, I'm going to tape over one of the toes, and it makes sense to either do it over the 3rd or the 4th. In this example, I'm going to do it over the 3rd, but you should test out whether you get better results from the 3rd or the 4th for each individual patient. So with the tape here, I'm going to tear the backing paper so the backing paper can be moved out of the way, and then I've got the middle part of the tape there exposed like so. There's the glue is exposed. Now what I'm then going to do is carefully fold the middle part of the tape like so, okay, and then I'm going to use that to place it over the top of that 3rd metatarsal. So let me just pop that over there. It's a little bit fiddly, this one. There we go, in the web space there, and then I'll thread that through the web space here and loop it over the toe. You want to try and get the tape as high up the toe as you can, so right up into that web space, and that's helped by the fact I folded the tape over. Otherwise it would be sticking to my toe and it'd be much harder to try and get that in place like so. Okay, now let's switch camera position so you can see what's going on as I fix the tape underneath the toe. So from here, I'm going to take the tape, let's pull that one out of the way a second. There we go, just ignore that one. Okay, focus on this bit here. So I'm going to take the tape, add some tension, and pull it round underneath the foot like so. So it's going to be holding that toe down. And also, I've been careful where I finished the tape. I didn't want to put it under the ball of the foot because that's naturally an area that takes a lot of weight and rubs around on the floor or in your socks and shoes when you're walking. So therefore, if I just finish the tape off here, it should be out the way and less likely to be rubbed off. Now I'll take the other piece of remaining tape, and that's going to come across, again, holding that toe down, give that a bit of a pull that tape down, and pull the tape and stick it down underneath the foot. Again, just avoiding that weight-bearing area on the outer part of the foot there, and bringing the tape round, finishing off like so. As you can see on the top there, there's just a neat bit of tape looped over the top of the third toe, tucked into the web space, and then underneath we were careful to make sure that we positioned the toe and pulled the tape with some tension, on the other side. If you're wondering how much tension, I would say start off moderate tension, that's probably in the region of 60 to 70% stretch. See how you get on with that. You might need to add more stretch, and you might need to position the toe down a little bit more, but you'll soon know if it's going to help. And if it does help, then you can experiment with adding more pull on the tape, or of course experiment with putting the loop over one of the other toes, trying the fourth toe first, and then having a think about whether it might be helpful over one of the other toes. But I've tried the third toe here, and I can feel that that's restricting and having an effect on the movement already. So now it just remains to test it with a walking test. So that's the Mortons Neuroma loop tape. Have a try and see if that helps you. And if it does, please leave a comment in the box below. This next strategy might seem a bit random to you, but please have a look and pop a comment below to let us know what you think. So if you've got some footwear that you don't want to get rid of, because in lots of other videos, including mine, we've said you must have a wide toe box in your shoe and don't have any heels because it takes pressure off the front of the foot, which is all very well. But if you follow the advice of my videos and lots of other videos, you'll end up either not using or throwing away lots of perhaps perfectly good shoes. So what about if you could modify your shoes? What about if your shoes could just be expanded a little bit, especially in the toe box area? Or maybe you've just bought some new shoes and they need wearing in and you want to try and do that a little bit faster. Well, you can buy shoe stretchers. They are inexpensive things which you can grab from shoe shops or off the internet, and they're a lot cheaper than you think they might be. And what they do is, well, they stretch the shoe, obviously, but they work in a couple of different ways. One is they can expand the length of the shoe by twisting the back here, and that brings this piece back, pushing against the heel and pushing into the shoe, so they can expand the length of the shoe, or at least stretch the leather of the shoe. And the other thing is, if I twist this end, it actually opens up the front, which can help to stretch out the toe box of the shoe as well. And in addition, you get these extra little nodules that you can fit in different positions. So if there's a part of the shoe which is pressing into your foot, or a part of the shoe where you want to try and stretch and expand it, then these bits here can push out on specific areas in the front of the shoe to create more space. So if you had a knobbly bit in your foot, like a bunion, for example, then you could use these to create a bit more space in a specific area. So very simple to use, as you can imagine. You pop them into your shoe, twist it here in order to push the front piece into the front of the shoe there, and tighten that up. That will start to stretch the shoe like so. And then twist here, and that will start to expand the front of the shoe. Now, the trick is to do this and leave it in place for a number of hours, and then to keep tweaking it and expanding it, rather than just pushing it and twisting it as hard as you can. Obviously, there's a risk of damaging the shoe there. So use some leather softener, pop it in, put the nodules in any places where you want to expand, and particularly if you have got new shoes, it can be a great way of softening them up and spreading the toe box and just helping to make the shoe more comfortable. Okay, so that concludes that strategy, using shoe stretchers to soften up and make your shoes more flexible. Now, nearly all non-surgical Mortons Neuroma management programs recommend doing something or anything which helps to work on the flexibility or reduce any tension or stiffness in the ankle, and therefore in the calf muscles as well. So here I'm just doing a simple demonstration of some self-massage or foam rolling, and it's as easy as it looks. And it's a form of self-massage which can help to reduce sensitivity and tone over the posterior calf musculature, and therefore potentially increase this movement of the ankle that's upwards. This is the dorsiflexion action. And that's important because when you're walking, When you're walking, your ankle needs to dorsiflex as we're walking along flat ground, and if we're going uphill, for example, then the ankle is going to need to dorsiflex even more. Now, if your ankle is stiff and isn't flexing as much as it should do, then you can appreciate the heel is going to lift and more pressure is going to go through the front of the foot. Plus, if the bend doesn't come from the main ankle joint, it's going to have to come from the front of the foot. Now, the front of the foot is designed to flex and bend, of course, but it's going to be compensating. If the ankle is stiff, it's going to flex and bend more as it has to compensate for a stiff ankle. So as I'm demonstrating here, this is actually a good stretch in itself. Put one foot forwards, the leg you're going to stretch is behind, toes facing forwards, and then bend forwards whilst keeping the heel on the ground. Don't let that heel lift off, keep that heel down so that you stretch the calf muscles here. And you can do that with a straight leg, holding it for a few seconds, letting the muscle tension reduce slightly, so then you can see if you can stretch a bit further. And you can also do that with a bent knee, and that will make the stretch feel like it's coming from a little bit lower down. So there, bent knee, straight knee, bent knee, straight knee, and self-massage using the foam roller. So we've got to the end of the video now, and we've covered 7 strategies that you can use to cure or reduce the pain from your Mortons neuroma. I hope you found them helpful. Please like the video if you have, and as I've said before, leave a comment below if you found one of the techniques particularly helpful, and then we might do a video focusing on that particular technique next time. If you know anybody else who is suffering from this condition, then please consider sharing the video with them. And there's also some videos which will pop up on the screen here which you may find helpful, and there might be some things on the physio channel which you or your friends might find helpful as well. Otherwise, that's it for this video. Thanks for joining us, and we'll see you soon.